Welcome everyone to the Committee of the Whole meeting of Tuesday, March 10th, 2026. Just a reminder that this is a Committee of the Whole meeting and no decisions will be made here today. There will only be recommendations that will go to our next regular council meeting on Tuesday, March 24th, 2026 for consideration. A couple of reminders for today's meeting. Members of the media may sit in the upper balcony at the reserved media table. All other guests, please take a seat in the first floor gallery. If that is full, there is overflow seating on the second floor in the Victoria Room where you will be able to see and hear the meeting. We live stream the meeting on our YouTube channel and the recording is available after the meeting. Because meetings are accessible to the public in this way, video or audio recording by members of the public is not permitted in council chambers. This is to ensure that all attendees and those who come to make a deputation feel at ease. Thank you for your cooperation. Do I get a motion for the adoption of the agenda? Councillor Joyce, Deputy Mayor Richardson, all in favor, and that's passed. Any disclosures of pecuniary interest on anything on today's agenda? Seeing none, should any arise, advise the chair and we'll deal with it accordingly. Moving on to presentations, our first presentation is Paramedic Service Operational Key Performance Indicator. Paramedic Chief Johnson. Whenever you're ready.
Thank you, Mr. Mayor, and good morning, everybody. We're really appreciative of your time this morning to talk to you about paramedic service and to provide an overview of the department's performance for 2025. Just starting with a few introductions to members of our team, some new faces here today. We have Deputy Chief of Operations Stephen Lucas. We have a few of our superintendents here today. Superintendent of Staff Development and Wellness, Brandon Ferguson. And Superintendent of Field Operations, John Gorniak, on the end there. And up in the rafters, we have a operational superintendent that's actually on duty today, Jeremy Jackson. Deputy Chief Jamie Golden's away this week and unable to join us. So in the interest of time, we're going to be covering a few key highlights, but certainly for the full report, it's in front of you for review and also published online. Having seen this report before, you're well aware that metrics help us track our progress year over year. They also help us make really informed evidence-based decisions. The paramedic service has a master plan, and certainly that provides a general roadmap with recommendations over a period of time. And this really serves as an annual complementary source of information to that master plan. It ensures that we are making the right decision at the right time based on evidence in our performance rather than just the plan alone. So it's quite powerful. When we're talking about data, it's always nice to have comparator information, but comparator information in paramedic service in Ontario is quite lacking. There is one good, reliable source of information that's published through the Municipal Benchmarking Network, or the MBN. And they track 6 key EMS metrics. So we've included those comparators where we can within the report. It is important to know that the MBN last published in 2021. So given the significant changes since then, it may be a little less reliable as a comparator. I am going to turn it over briefly to Stephen and then Brandon. They're going to discuss a few key initiatives in their respective portfolios where we're really trying to improve and move the dial within metrics that are directly related to this report and prioritizing for 2026. So over to Stephen.
Good morning, everyone, and thanks for having us. This is kind of my third round with this with you folks. So what we've done in the past is kind of just said what our responsibilities are, but this year we're kind of switching it to what our focus is in 2026. So one of the things that we're responsible in operations is the deployment of the resources, and I think you are all well aware of the MPDS system that we have switched to, which has changed the game quite a bit for a benefit for the community as well as our staff. So that's a win-win, and we're tweaking that deployment plan that's been evolving over 10, 15 years to now the new system. So we meet quarterly with the Ministry of Health as well as our neighboring services within the Northumberland, Peterborough County and Haliburton County. So that's one of our focuses for the year moving forward now that we have a year's worth of data to look back on. Another thing that we're responsible for in our operations is labor management, and thankfully last year we were able to ratify a contract which has gone well, and now we're into our labor management commitment with the committee meetings on a quarterly basis. And we'd like to do a shout out to our local union. They've been excellent to work with, and we've been able to make changes to be more efficient for all involved, and even make some savings. So that's been great. They've been a great group. When it comes to our fleet, we all know there's a large project on the go, and we're transferring from kind of more design phase into the construction phase. And we're trying to incorporate our partners, whether it be like the Ministry of Health for our communications needs, as well as our IT department to get those needs done in real time during kind of the rough-in phases and things that need to be done, so there's no delays with that. When it comes to our fleet, with the help of the Early Start program, we're getting 9 units this year, which is a great win for us, and we had collaboration with corporate services as well as council to get that done, and we'll be in really good shape after this year. It's a lot. 9 is a big chunk of our fleet, so our plan is to try to stagger that mileage on them so that it's not 9 a year. If we could get to 3 a year to make it more, easy on the budget, and that's our goal. With equipment, we're pretty excited about a few things there. The canoe contract that the city has, one of our vendors have signed in on that contract, and there are 3 or 4 of our large ticket items, and we're being told anywhere from 10 to 40% savings. So we're working with procurement, and we're going to make sure those numbers are accurate, that 10 to 40% savings, and move forward probably with that. And something new to our service is the HyGen system, which is a hydrogen fuel cell system that transit, you've probably been educated on with Rod Porter. He kind of introduced it to us. And we're pretty sure we're one of the first emergency services to trial this, and we just had it installed in one of our units. So we have the pre-installation kind of data to compare it to post-installation. And we're being told a 20% fuel reduction as well as up to 60% emissions reduction. So we're pretty excited about that as well. And then finally, just onboarding. It's an ongoing concern with us to make sure we have the staff out there to support the community. And we're just at the end of this month going to start some interviews for new staff, which kind of aligns with the end of college programs. And I think we have 50 applicants that we're going to interview, so it's going to be a busy couple days doing that. And that kind of wraps it up, kind of our focus for the 2026 on the operational side of things.
Thank you to you, Deputy Chief Lucas. Thank you for having me today, us today. I'm excited to share some good news stories on the professional standards side of things. A large focus on our arm of the service is on ensuring that we are compliant with ministry standards and the Ambulance Act. And while this doesn't necessarily directly relate to the KPIs we're talking about today, of note this year in November, we will be hosting the Ministry of Health for our review. We are always preparing for that and have been basically doing so since the last review 3 years ago, but that will be a big project for our department in preparing for that this fall. Community paramedics had some great news. In September of 2025, the province announced that funding was going permanent for that. So it made sense at this time to look at 2026 as a review year for the community paramedic program as a whole, with the goal of eventually developing a long-term plan similar to the master plan that we use on the 911 side of things. So positive news there. We've applied for 2026-2027 dedicated offload delay nurse program funding again. And since the inception of that program, along with other initiatives with the Ross Memorial Hospital, Offload delay times for our paramedics at the Ross Memorial they've moved the number from placing 56 out of 75 hospitals in the province down to number 10. So that definitely has some positive trickle-down effects that affect our response times, unit hour utilization, and code zero. So all metrics that we're looking at today. So another great news story there. This fall, later on this year, we're looking forward to welcoming a new superintendent of staff wellness to implement some kind of positive initiatives around mental health in our service. And it timed out perfectly with a Solicitor General grant that we were awarded the end of last year that we've been implementing since, and that is the MHS for PSP grant. So the Solicitor General allocated $32 million to the 80,000 plus public safety sector employees across the province, and we applied and were awarded the maximum for our demographic, which was $25,000 for mental health training within their basket of services. And to date, that has led to 38 hours of mental health training between our management team, our peer supporters, and frontline staff. And we're just kind of reviewing the needs on our peer support team for the remainder of those funds. So lots of good news stories on the QA side of things. Thank you.
All right, so you may recall a presentation last year on the Medical Priority Dispatch System, or MPDS. Traditionally, 911 dispatch has over-prioritized calls, and MPDS is a more accurate way of assessing the urgency of people calling into 911. It's had a pretty dramatic effect. We went live with MPDS in March of 2025, so I'll be highlighting a few areas that it impacted the metrics, and this is one of them. This is our call volume, also an indicator of service demand over the last 5 years, with 2025 showing in the top bar. So if you look at the graph on the right, that is all vehicle assignments. So that includes all patient-related calls, which are shown in the green, the yellow, and the red. And then that light tan color is code 8s or standbys. A code 8 is a call to move an ambulance strategically from one area to another. So for example, if the Fenland ambulance is busy, we will strategically move an ambulance from Coboconk to Fenland Falls to cover off that area till Fenland returns. The trend that I want to highlight is that year over year, patient-related calls have been increasing, and because of that, we've had to make some changes and adjustments to our deployment strategy, including decreasing the amount of code 8s. If you take out those code 8s and you focus on patient-related calls only, you get the graph on the left-hand side. In 2025, the service responded to 14,193 patient-related calls. That is one 911 call every 37 minutes and a 2.55% increase from 2024. So certainly a busy system. We're becoming busier each year. The other trend that I want to highlight is the change in call distribution that you see in those colors in 2025. So green is our non-urgent or our low priority calls. Yellow is the urgent call category, and red is our emergent or our lights and sirens response. So through MPDS and that more robust triage tool, it has decreased the amount of lights and sirens response by about 20 to 25% overall, and increased the amount of calls that are being more accurately assigned as a low priority. So that's a really big shift in the way that paramedic calls are assigned and the work that we do. This is our response time performance over the last 3 years, with 2025 showing in the dark blue color. I'm very pleased to report that despite that increase of 2.55% in patient-related calls, we've been able to meet or exceed all of our response time targets that set out within that plan. And I can credit MPDS to this, likely, along with some service enhancements that I'll talk of shortly. This is another volume measure. It is per capita service demand, or essentially it refers to the number of paramedic calls per 1,000 residents. You can see the yellow line across that graph, and that is the municipal benchmarking network comparator of 127 calls per 1,000 people. And the trend in the background with those blue bars is the trend in Kawartha Lakes over the last 5 years. And in 2025, we had 179 ambulance calls per 1,000 residents, which is quite a bit higher than that comparator. There's quite a few reasons for this. Predominantly, the demographics or age of our population is more senior, and also the availability of resources outside of calling 911, things like patients being attached to a primary care provider, urgent care clinics, and other alternatives. This is a critical indicator for us, something that we watch and monitor closely, and I'm just going to spend a little bit of time here. This is our system utilization. It's also an indicator of how busy we are. It's referred to in two different ways on this slide, and we're going to start with the top right graph, which is our system utilization rate, or our UHU. It's the percentage of time that our paramedics are actively with a patient. There's lots of responsibilities that the paramedics have throughout the course of their shift that aren't included in this. Things like documentation, restocking, cleaning in between calls. It's strictly the amount of time they're with a patient and they can't do anything else. Conversely, it gives us a really good indication as the percentage of time that our ambulances are available for new emergencies. So there's no set UHU, but the industry standard typically considers 35% as the maximum threshold, and you can see that by the yellow line in the top graph. In 2023, we were getting close to or approaching that 35%, and with council's support and approval, along with recommendations that were listed within the Paramedic Service Master Plan and this report, we made some key enhancements in the following years. We added a daytime ambulance in 2024, we added a nighttime ambulance in 2025, and we have been working really hard in the background on other initiatives, the implementation of MPDS, and working really closely with our local hospital to expedite offloading patients coming in by ambulance. And those changes, those enhancements have made a real significant impact here. Our UHU dropped to just below 30% in 2024, and then just below 31% in 2025, which means we have a little bit of room there to absorb some growth rather than being close to or at that critical breaking point where we're being very reactive, and that's a situation we don't want to be in. The bottom right is our ambulance code 0 rate. That's the amount of time that our system's spending with 0 ambulances available in Kawartha Lakes. It's a real risky period of time. It means if a new ambulance comes in, we either have to free up a resource, so paramedics are trying to free up from a patient at the hospital, or an ambulance is responding from another service, and either of those things are likely to mean a delay in response time for the patient. So it's a very risky period of time, and we watch this closely and do our very best to mitigate this number as much as possible. With those enhancements that I mentioned, it's made a pretty staggering impact, a positive impact in this trend. We've decreased our code 0 by about 91% in the last 2 years. In 2025, we had a total of 15.3 hours of code 0, which equates to about 2.5 minutes a day. I think this is a real positive story. For the first time since I've been looking at these metrics, the trend line that's shown in yellow is actually tipped downwards. Up until last year, it was trending up. So really, really positive, and speaks to the service and council's commitment to make sure that our resources meet or exceed the demand for service. And I think this is a really good, positive story. This is our cross-border volume over the last 5 years, with 2025 showing on the far right. MPDS has had a huge impact here. The dark blue shows the calls that we are performing in other municipalities, where the teal represents calls that are being done in Kawartha Lakes by neighboring services. So you can see that Kawartha Lakes is still overall a net receiver of mutual aid. We get more aid than we provide to other services, but this number is significantly improved from 2024, and we can credit the service enhancements, but mainly MPDS in this realm. This is the paramedic time spent in hospital, or essentially offload delay. I'm not going to get into the metrics very much. I think the report really spoke of this, but this was a priority area for us in 2024. We were losing a very large amount of time for our paramedics spent on offload delay at the hospital. And Brandon alluded to the inception of the dedicated offload nurse program, and that's been very successful in decreasing the time spent on offload and sustaining that measure, which is really good news. It's holding in 2025, and as such, the Professional Standards Division has applied for ongoing grant funding for that program, and we're waiting to hear from the province regarding approval. We're going to shift into finance or funding measures. So the graph represents this in 3 different ways. The first cluster is our operating cost per capita. The second cluster is operating cost per event. And the last cluster is operating cost per unit hour. And we're going to focus on our operating cost per unit hour. And you can see that red line within that cluster, and that represents the municipal benchmarking network comparator of $241 per hour. Our operating costs are quite stable. In 2025, we were just shy of $246 per unit hour. So a reminder that that's a 2021 comparator from the municipal benchmarking network, but really pleased to see that costs are stable in that measure. This is our fleet measures, or our fleet operating costs more specifically. Once again, this has stabilized in 2025. Largely due to the fleet renewal project. We've worked very hard with corporate services in our department. Along with council approval, we now replace ambulances under Early Start, the Early Start program. It still takes about 1.5 to 2 years to receive an ambulance from the time that you place the order. So what the Early Start allows us to do is we order the ambulance 2 years before it miles out so that we get it when we need it, versus extending the vehicle well beyond end of useful life, which was causing some issues in our operating costs and our maintenance budget of that fleet. So really impressive work there to stabilize those costs. The other thing I would like to highlight, Stephen spoke to it, is the HiGen pilot. I think that's really exciting, and we're anticipating looking forward to seeing what the results are from the HiGen fuel trial to see whether or not it informs some more environmentally friendly options around emergency services fleet. And this is the last metric that I'm going to speak to specifically, and this is around occupational health and safety. I do want to focus on the graph to the bottom right, which is the total lost time in hours for our department over the last 5 years. There is a caveat to this. The number is increasing as our staffing complement increases. As our call volume increases, the likelihood of occurrence becomes higher. But we lost about 2,712 total hours of lost time in 2025. That's equivalent to about 1.25 full-time people. And this is a priority area for us for 2026. It is an area that we need to do better in ensuring that we have more robust, proactive wellness strategies for staff that are both in and out of the workplace. So a few key takeaways that I hope you got from the report and our presentation, and they're in different categories. So in terms of service demand, our demand continues to grow at a pretty steady and predictable rate. It was 2.55% in 2025. I think that we have to give accolades and credit to service and council-approved service enhancements that have really stabilized the unit hour utilization and significantly reduced code zeros, which are a very risky situation for our service and for patients. And we're able to say with this report annually, and again this year, that it aligns with the Paramedic Service Master Plan. Our system is showing signs of being pretty healthy. It's in a pretty good state and condition, and as such, we have no paramedics that will be added, no frontline paramedics that will be added in 2026. Our Paramedic Service Master Plan indicated a potential enhancement or addition of a 12-hour ambulance in 2027, and some other services, other municipalities with the implementation of MPDS are looking at alternate models. Is the answer always adding another ambulance, or is it looking at other strategies, things like ramping up community paramedic programs, a single paramedic in a response unit to look at those low priority calls rather than just adding an ambulance every other year? So we'll be looking at that in 2026 and before budget in the fall. In terms of financial performance, our unit hour cost is stable and within the MBN range. And those recent investments are showing incredible value through a system that is more reliable and performing much more efficiently. In terms of staffing and safety, injury rates have become a priority area for us in 2026. And we are building capacity around employee well-being. I didn't speak to it in this presentation. It is spoken to in the report about the amount of advanced care paramedics in our community and superior performance in that area, about the level of care that's provided to our residents. And hopefully you can refer to that later in the report. In terms of fleet costs, we're seeing early benefits from the ambulance replacement program through Early Start. And we're looking at the HiGen pilot and hopefully positioning the service for some future fleet decisions. Once again, I didn't speak to it specifically in the presentation, but we are looking more at our patient satisfaction survey. We rolled that out about a year and a half ago, and it's really not giving us good quality information. So that's being refined to include more voice of the client feedback within our KPIs and our reporting. So with that, that ends my formal presentation, but I'm happy, or we are happy to take any questions.
Thank you. Let's get a motion to receive the presentation. Councillor Doble, Councillor Perry, and questions, Deputy Mayor Richardson.
Thank you, and through you, Mr. Mayor. Thank you very much for the presentation today, and there's a lot of good news in there, and it really shows the impact of that MPDS system that you guys have implemented the last year, which is pretty incredible. Just two quick questions. One was with page 14. You noted that in 2026 there's no planned additions for ambulances. In 2027, you mentioned enhancements through alternative deployment models. What criteria is it for you to determine if a new ambulance is required or a deployment model change is required?
Through you, Mr. Mayor, to the councillor, it's a good question. And that review is going to be undertaken in 2026. I think it is, we have to look at the volume of patients that are needing transport to the hospital. If transport's required, then an ambulance addition is probably the answer. If those calls can be handled more appropriately in home, especially those low priority calls, and whether they can be handled by a single paramedic or a community paramedic without requiring transport, that would be more suited for some of those alternate strategies. And that's what we're going to be reviewing in 2026.
Thank you, very good. And the follow-up then to that is that now that community paramedicine is completely funded, what opportunities exist for that 911 demand to cover up some of the more vulnerable folks, which probably will evolve into what you just explained to me.
Yeah, very much so. Ramping up community paramedic programs and using that as an alternate strategy to respond to low priority calls, to treat people in their home and allow them to remain there instead of transporting to hospital is really the expertise of the community paramedic. So deploying them more in those areas is a potential alternative to a 12-hour ambulance.
Thank you very much. And like I said, this update today really shows how much we've advanced in the year with those extra tools, and there's a lot of good news in there for the community. So thank you very much to all of you.
Councillor McDonald.
Thank you, through you. A couple questions. Code 4, I noticed there in the report that 2024 Halliburton up to 105,000. In 2025 you got it down to 35,000. Can you tell me how you did that, and can you continue doing it?
Through you, Mr. Mayor, to the councillor, through MPDS, we have been able to effectively reduce the amount of cross-border support. So we have an agreement with Halliburton County, and we compensate them for calls that they do within Kawartha Lakes. And in 2024, we paid Halliburton about $105,000 for that service that they provided within the community. Because of MPDS and the service enhancements that we spoke of, we're better covering our area, especially towards the borders of Halliburton County. And that reduced the costs to about $35,000 in 2025. So it was a savings of about $70,000 through those deployment strategies and the implementation of MPDS, which is really an incredible impact. And it shows that we're better covering off our community, that we're performing a better service, essentially.
Great news, thanks. And just to talk about the fleet, you and I talked earlier that, we put 300, 400,000 kilometers on these vehicles, so I guess that would be the basis on how and when you should order new ones. So that's good that you have a plan to make sure we can order them when we need them and get them, because it takes 2 or 3 years, and with the tariffs and what's going on in the world right now, it might even take longer. So, and that's good. And then you talk about the hydrogen vehicle. Are we the first municipality to do a trial run on this? Are we the only ones that are doing this?
From what we see, Rod was first in the municipality to use it, and when the paramedic side of things, what we've looked at is the first paramedic service within the province to trial this. Yeah.
That's excellent. So, and on that point too, is that I hear that we're gonna be working closer with the hydrogen people to collect data weekly, monthly, look at the, things like performance, cost, quality, and so on. I think that's the plan.
Yes, absolutely. We haven't set out like a timeline yet. Initially, what they did when they installed it, they did a pre and post emissions, and we're waiting for that report just to see right off the hop what the reduction of those emissions are. And then when you do the math, it's going to take about 3.5 years to pay for the unit, but then you can switch it over to a second unit, so you get 2 lifespans of a vehicle. And when we're looking at that, we're going to be some savings there, and then the emissions reduction is the greater benefit, I think. Yeah.
That's great news also. Thanks for that. And one last question is that the offload at the hospital, if we don't get the funding, do we have a plan how we're going to handle the offload if we don't get the funding?
Through you, Mr. Mayor, to the councillor, I'm confident that we will get the funding. Typically, the ministry has supported, especially municipalities that have had ongoing funding. So now that we're in the door, I'm confident that will continue. We'll look at alternate strategies if we have to, but I'm pretty confident it will continue.
Thank you very much for the report. That's it.
Councillor Warren.
Yes, thank you, through you, Mr. Mayor, and thanks for a great report, Sarah. I'm just going back to your one of your first bar charts and talking about standbys. So I just want to be correct. Are we not going to be doing standbys going forward?
Through you, Mr. Mayor, to the councillor, we're still going to be doing code 8s or standbys, and that is the movement, strategic movement of ambulances from one area to another. It's important that if we're moving an ambulance, it's for a reason, that that area is depleted, it has no ambulances available, and that that area can be effectively covered. So we're still going to be doing standbys. It's just the number of them isn't quite as high as what it's been in previous years.
Okay, thank you.
Thank you. Councillor Perry.
Thanks very much, Mayor. And Captain Johnston, thank you for the report. Thanks to your team. So helpful to have this update. I'm glad to hear the community policing, paramedic program is going so well. I remember, how many years ago was it when you and I sat in my office there at the health team and kind of hatched it and tried to get uptake. So really glad that's working out. I just had one question from page 4 of your report when you talked about the calls you're getting.
Can we just concentrate on the presentation for now, and we'll get to the report in a minute?
Oh, okay. Yeah, sure, Mayor.
Okay.
Yep.
Thank you. Councillor Joyce.
Thank you, Mr. Mayor, through you, and thank you, Chief Johnson and team. Starting off, the MPDS is really good news story. I remember your presentation in 2023, and those code zeros were just ramping up. It was a huge, huge concern. So really good to see that and the extra ambulances working here. Just got a couple questions here. You referenced the canoe contract. Maybe you missed that. What is that?
It's a procurement agreement with the city. It's kind of a group purchasing group. I thought you guys were aware of that. So we're able to leverage that for getting some discounts that way.
It was probably in one of the reports that we read somewhere. my mistake. Second question is the average time at hospital and average offload time. Sorry, what's the difference between those two?
Sure. Through you, Mr. Mayor, to the councillor, the average time at hospital is the time that the paramedics get there to the time that they leave. And they're mobile, they're back out on the road. The average time to offload is the time that the paramedics get there to the time that they offload their stretcher. So they would still have to clean up, get their stretcher ready, restock their vehicle, do their documentation, and then be mobile. So that's the difference between those two metrics.
Right, documentation. Thank you. I can imagine what that's like. Your vehicle cost, unit hour cost, the 2025 unit hour cost, is that in 2025 dollars?
Through you, Mr. Mayor, to the councillor, yes.
All right, then I would propose that it's actually gone down, because if you factor in inflation from 2021, if you baseline it at 2021 dollars, your per unit cost is actually going down. So good work. That's all I have. Thank you very much.
Thank you. Councillor Ashmore.
Thank you. Through you to Chief Johnston. Thanks for the presentation, and thanks to the deputy chiefs and the staff of the EMS. Just a couple of questions. The first one was this. So just sort of clarify, standbys are basically when you strategically position ambulances, for example. We've been doing that, or you had a different name for it. I think we used to keep one at Willowdale Court, which was really good, because it was, that area of course is probably the highest traffic in the whole city of Kawartha Lakes, with Highway 7 and 35 merging together. And also, we used to have them, maybe we continue, but in Dunsford, it's right geographically between Lindsay and Bobcaygeon, because we don't have an ambulance station in that area. Are we still going to be doing that randomly, placing ambulances in those locations or other locations other than the ambulance stations themselves?
Yes, with MPDS, it's kind of changed. We've divided into a north and south zone, and with that, there's some responsibility to keep units available to those zones. Before, with the old system, the DCPI, we over-triaged a lot of calls, so those code 4s that were lights and sirens responses, they're now reduced, so they're considered low acuity. And when our resources get low, we're able to hold 2 units available and hold those low acuity calls, which is more responsible and safer for the community. And there's some impact on the hospital, which we're working with them for inter-facility transfers, some of those will get held only when our resources are low. So it's more of an effective way through MPDS to make sure we have that balanced coverage. We do provide standbys based on the resources, but that's where deployment in MPDS, we're always kind of rotating to make sure we get the balanced coverage for that.
Okay, thanks. And just finally, as was mentioned there, Councillor McDonald mentioned about the offloading at the hospital. I know when I was on the on a shift a couple of years ago, that was what the paramedics, it takes so much time waiting for the go-ahead to get back on the road again. And that's good that we're trying to work with the hospital and the ministry to get ambulances in and out as quickly as possible. I know that's really frustrating, so. But again, thanks for your presentation and the success here.
Thank you. Yes, thank you for the presentation, and thank you for the work on it and bringing council up to date. We have a motion to receive the report, to receive the presentation and forward it to the next regular council meeting. All in favor? And that's passed. Moving on to the report, can I have a motion to receive the report? Deputy Mayor Richardson, Councillor Warren, any questions or comments on the report? Councillor Joyce.
Thank you, Mr. Mayor, and just through you, just one question, and that is time for complaint investigation resolution. Is there any way to, well, two questions. Is that in days there, is that business days or calendar days? And any way to tighten that up to have a faster turnaround for a resolution?
Through you, Mr. Mayor, to the councillor. Also a good question. That is calendar days, so that's from the start of investigation to completion. I think it was about 23 days or something like that in 2020, currently 23 days. And those investigations could be anything from a missing item right through to a larger complaint. And some of our complaints are multifaceted, so some may involve the Ministry of Health, our overseeing education body, which is a Central East Pre-Hospital Care Program. So paramedics are incredibly governed. I would say that we do our very best, and that's probably as tight as it can be at this point.
Understood. Thank you.
Councillor Perry.
Thank you, Mayor. Just a question on the report there, just on page 4, and the types of calls you're getting. I know some of us around this table, my fellow councillors, have talked about receiving calls that aren't necessarily on point for the municipality, or someone needing someone to talk to. I've encountered some loneliness at doors, going door to door. I remember last presentation you talked about an increase in those types of calls that weren't necessarily requiring EMS response. How's that these days? Is that continuing? Is it stable? Is it going up? Do you notice? Just curious about that trend. Thank you.
Through you, Mr. Mayor, to the councillor, I don't know, to be honest. I think that's part of the community paramedic review that we're going to be looking at, as well as the deployment strategy. Is the answer another 12-hour ambulance in 2027, or is it something else for those low priority calls? So that's part of the review in 2026 that we haven't done yet, but we'll be doing this year.
Great, thanks. Good to know. It just seems there are sometimes folks who are looking for someone to call. And I was just wondering if you were seeing that increasing as per the last report. So we'll look forward to learning more. Thank you.
Thank you. We have a motion to receive the report and forward it to the next regular council meeting. All in favor? And that's passed. Thank you very much for today and coming and educating us. And we'll call on Chief Jones to give us the fire report.
Morning, Mr. Mayor, Deputy Mayor, Council. Thanks very much for your time this morning to hear our annual report. Before I start, I'd also like to introduce a couple of my senior management staff. We all know Executive Assistant Valerie Knights, Deputy Chief Sean Moore. Deputy Chief Bignell is also out of the country at this point, so he could not attend. Also like to thank our admin assistants at our office that certainly helped us put this report together. This year we kind of had a change in our management, records management system. We went from Firehouse to ICO, so we're trying to pull data out from 2 different locations, so it was just a little more difficult than usual. I should have maybe went first before the paramedic, because I'm not sure our report is quite as rosy as maybe theirs was, but we'll continue on. So why we do our annual report, basically ensures transparency, accountability, compliance, and communication. It's also part of the Fire Prevention and Protection Act. As the fire chief, I'm responsible to council for a yearly report. Our department overview, organizational chart, has really not changed much from the previous year. Our only major addition was one more district chief, which allowed us to kind of break the city into 3 different districts, which allowed us to create better organizational structure. As you can understand, one deputy chief for 19 stations wasn't working out so well, so we've included the platoon chief and one district chief and moved it into more of an east, how does it go? South, north, east command or something. I'm not sure how they got it broke down, but in our fire prevention and public education, you will see that our total number of people that we reached out to is a little down in from 24 to from 25. Some of that number in 24 might have, because we had the international plow match also here, which certainly would have increased some of our numbers. We did still focus on a lot of community events within the city, more larger groups, and say some personal things where we could actually count the numbers a little. Some of those events, we did a joint venture with the waste management, which mainly dealt with lithium battery safety. Another one was new, which we'll continue in the new year, was our Fire Smart program with the MNR. So those were a couple of large events that moved forward too. In the 25 season, they still continue to do their continuation with the grade 1 students for fire safety education. This year they've developed a program which will be starting in 2026 to deliver to the grades 3 and 5. And also we've continued with the community education engagement with public events, station tours, open houses. We did have a little increase in our fire extinguisher training over the previous year. And a new, and I think a very important thing that we started in 25 and will continue 26 was targeting public education within our Kawartha Lakes multi-unit residents. Those are like our buildings that we own within the city, 68 Lindsay, 20 Sussex, 19 Hamilton. There's 24 that the city actually owns. So just to improve the resident awareness and evacuation preparedness. So I think that is a great program that we've started and will continue to finish in 2026. Under our smoke alarm program, CO alarm program, our numbers were up a little. Not as high as I would wish, but we have developed a new program starting in 2026 that allow us to basically, ideally, when we go into a person's house, maybe not for medicals, but for any type of thing, we'll be doing a lot more documentation because we're already in the house. Do they have the working smoke alarms? So, and just be able to track those numbers. So I'm anticipating that number will certainly increase. The smoke alarm assistance program, if you're not aware, that's where elderly or anybody that cannot install their own or test their own smoke alarm, they can call our office and we will send somebody out to either install or check their alarms for them. So that's a great program for the elderly, that's for sure. And our numbers did increase a little, but at least it's still being used. So I think that's great. Inspection enforcement, or second line defense, you'll see our inspections did go down a little, but our focus this year was multi-unit buildings, which take a lot more time to go through those buildings and the paperwork, and there seems to be a lot more discrepancies, so there's a lot more follow-up. So you'll also see our burn permits were up quite a bit, agricultural burn, special permits, and our short-term rentals were down a little. But, critical incident support team, we invested about 45 hours assisting peers as part of our one-on-one peer support program. We did have two larger group debriefings, which we sent in at least 3 of our support team members to attend each of these sessions, and you'll see one of those sessions was actually done in cooperation with the EMS peer support team. Our training division, we went through as continually every year. I'm sure if anybody's been on Facebook, you've seen a lot of pictures in regards to our ice water rescue training that is done yearly. In our recruit level 1, we put through 7 recruits last year, which completed, like I said, firefighter level 1. 28 firefighters completed our level 2. 12 firefighters are hazardous materials. We did last year also have the live fire training mobile live training unit, which 82 firefighters participated. That number is down a little because unfortunately our wildfires were going on at the same time, but it was still well attended. We had a new survival training course that 17 firefighters completed. And as always, we do our emergency first responder yearly, and we did 122 certification tests completed last year. Under emergency management, we did activate the EOC twice last year. One was for the ice storm, the other one was in response to an upcoming, it was the end of December, for a weather event, which actually didn't, lucky for us, didn't turn out as bad as it was anticipated. So our emergency control group completed our training. We used the ice storm as our training exercise, and we also have a new notification system on our phones using the Who's Responding app, so we did some testing on that. We're still little tweaks we got to do, but it was better than what we had prior. So, and after all that, we still completed our annual compliance requirements. Now we go to the emergency response overview. Last year was a very, very busy year for us. Unfortunately, there is a mistake on up on the top on the 2025 incidents. That should actually read 3308. I'm not sure if it got changed yet in your ideally package, but in the presentation, so that was an increase of 30% in calls overall last year. You'll see we had an increase of 68% calls in actual fires. Open air burning was up 71%. Our natural gas, our public hazard, that includes our natural gas leaks, CO fault calls, hydro lines down. So we can, say most of that, or that increase was probably in relation to our ice storm in March. The MPDS, they've talked about it so great on the paramedic side. I was anticipating, or we were anticipating, it would actually drop our medical calls down, but see, we still had almost a 20% increase in medical calls. So. The next slide, we show just the amount of calls. It just there's about increase in about $3 million in overall damage, estimated dollar loss within the city. I'm surprised that number wasn't a little higher. Some things it's tough for us to put an actual dollar value on. If we take like the elevator fire that we had, you know, that could cost those people millions and millions of dollars, you know, until they get up and running. And so it's tough for us to put sometimes a value on some of the larger fires. One good news, we can see our firefighter injuries were down a couple. Civilian injuries, unfortunately, were up. And unfortunately, we had 2 civilian fatalities last year. Our hired, retired, and resigned. You can see we hired a total of 50 last year. Our numbers look kind of bad. We had 18 retire, and we had 51 total that actually resigned. One thing about this, we still have 368 firefighters on the roster, so we're not in terrible shape by any means. And one slide that didn't quite make a presentation, but it is in your package that you'll notice we're down to only 3 fire stations that aren't meeting my minimum of 15 firefighters per station. And unfortunately, those are always the same ones, the Burnt River, the Kidmounts, and the Carden area, where fortunately we just don't have the people in the area to for us to recruit to be part of the department. First truck on scene. These are good numbers, actually. We've increased, except you'll see the Lindsay first truck in 8 minutes. Most of those calls would have been to outside areas we cover, like say Lindsay covers the whole Ops Township, plus some of the old Fenelon Township. So these are well out of the 12-mile radius, so they almost would fall into the rural, but we don't ever consider Lindsay really rural, so that number is not really that concerning by any means, but at least we have increased in the 2 other divisions in 14 minutes and a huge increase on our first truck in 20 minutes, so that is a good news story for us. Not sure how much we need to relive our couple major significant events, but just to show you, in March when we had the declaration of emergency due to the extended power outage due to the ice storm, we had 2,878 firefighter response hours and 1,200 firefighter storm-related hours. So the storm-related hours are keeping the warming centers over, the garbage, also going around keeping our generators up and running. So that's approximately $102,000 in staffing costs for that event alone. The wildfires, we had the 3 significant ones coordinated with the response with the MNR. And you can see the amount of firefighters, the resource that we had tied up. And don't get me wrong, those were not there. You know, I didn't have 237 of them there every day, but we probably had 30, 40 at each fire because the Prospect and the County Road fire was going on roughly at the same time. But you can see the amount of hours that was dedicated, and I certainly want to, which really shows the commitment and dedication of our firefighters to spend, like I said, some of them were there for the full 6 days at a time, but so yes, kudos to them. Our station overview, as we said, we had a huge increase in calls. This is just showing broke down by station, and just to show that it wasn't in any, particular area. It was pretty much spread out all over the city. you'll see on the right-hand side is strictly the Lindsay calls. That's full-time, and they usually run 30% of the calls per year regardless, so. The sys calls per station, and sometimes, well, thank you, sir. Sys calls per station, each, okay, I did have it on silent, but sys calls per station. So we have our regular calls one of the first where we showed the amount of calls actually per station. So if there's a call, that one station gets credit with that call. But, as per, if it's a structure fire, there's automatic 3 stations called. So these are where the assist calls come in. So you can just see it adds about another 722 calls to our overall call volume. And like I said, it's not just structure fires. There's sometimes accidents. Sometimes they may need a second station for manpower, or if some station's not available, then we have to call out other stations to backfill their area. So like I said, you can just see that, and that's a 34% increase from the year before. Automatic aid agreements didn't change a whole lot. I think we were up by about 10, and that's not counting Romera. Due to the Dalrymple Bridge closure, we had to set up an agreement, automatic aid agreement, because all our firefighters seem to live on the other side of the bridge where the fire hall was, so just to make sure we could get response, we had an automatic aid agreement, so they responded during that time 7 times. So. The one thing that I was very proud of this year is we find something I've been trying to work with, and we actually got it going this year, was our first Fire Rescue Service Awards and recognition ceremony. Some of the council and CEO did attend that, and we've just basically honored or made it a little more formal than we used to just go out to the stations. So this was definitely a little more formal for everybody that either received their federal, provincial long service awards, and anybody that had retired. And we did have a few peer-nominated awards that we added in, which was the Pride and Ownership Award, Most Dedicated Team Member, and a Duty to Act Award. So that was a event that was well attended by everybody, so that certainly we will continue that on for the rest of, hopefully, every yearly. So our 2025 major accomplishments, we did receive a $15,000 community wildland fire protection grant, which we will be putting into our Fire Smart program, which we'll start this year and set up some, we're working basically on the program at this point in time, but going around to hopefully a lot of the cottage associations and just get some wildland fire protection and show them how they can make their places more safer during wildland fires. We also received over $300,000 for our fire protection grant focused on firefighter health and safety to allow us to continue with our cancer prevention initiatives within the stations and within just for the staff itself. Our administration team, as I mentioned earlier, we have the new implementation of the ICO records management system. And we also digital transformation through introduction of automated fire service permits and a customer-focused citizen portal. As you'll see the lovely picture, it only shows 4 of them, but we did receive, thanks to council support, our 5 apparatus, 2 pumpers and 3 tankers to, and like these weren't additions to the fleet, most of these were replacements, and we did sell some of our other equipment, which was good to get some money coming back in. we mentioned probably before, our 2 volunteer firefighter recruit classes. We put through 52 recruits. Unfortunately, 2 had backed out on us. And our major goal from 25 and moving into 2026 is still to meet our certification. Staffing, the promotion of 1 personnel to the platoon chief and a full-time firefighter position was filled. And as I mentioned, the appointment of a new district chief. That is the end of my presentation at this time, and I'm more than willing to answer any questions you may have.
Thank you. Let's get a motion to receive the presentation. Councillor McDonald, Councillor Perry. Questions? Councillor Warren.
Through you, Mr. Mayor, and thank you, Chief, for your report. Just a couple questions. Can the municipality themselves do a no-burn designation, or do we have to wait for the ministry? I know the ministry has maybe some more data, but I get that question a lot because of the fire in Burt River. That's my first question.
Through you, Mr. Mayor, to the councillor, it is the fire chief's authority to put on a burn ban at any time. We do rely on the MNR for, I get a daily reports, which mentions numerous things of where we are sitting and, the higher lows if it's, if there is the possibility of, fires. Ideally, it just reaches out and shows us how serious things are out there. We do rely a lot on the MNR only because the MNR does take over half of the city of Kawartha Lakes. So when they put a burn ban on, we pretty much need to follow for the rest of the city. So they have their own zone, basically from Glenarm North is MNR protected. So that's where we kind of follow their restrictions.
Okay, thank you for that. And my second question is a 20% increase in medical calls. And this is another observation I get from quite a few people. If we're having that kind of increase, would it not make sense to have smaller vehicles to attend those calls? That would be less expensive for the bottom line, or having those big trucks go out all the time. Thank you.
Through you, Mr. Mayor, to the councillor. It is an additional cost of, how many vehicles we would put out there. I always kind of worry that if we're out on a medical call and we don't have the big truck and then you get another call, what do you do? But, and also sometimes, even the location of where we could put these vehicles, our space is running out, and not saying it couldn't, but honestly, it's not something we've really put out. I know a lot of bigger departments have that. They have the staff to have 2 or 3 guys respond, but at this point in time, we have not considered that.
Just a comment through you that maybe we should just look at the feasibility and the bottom line, whether that would make financial sense. That's all. Thank you.
Thank you. Councillor McDonald.
Thanks, through you. Just a couple of things here. The future, as far as the fleet in the future and so on, you said you sold the fire trucks. Who buys them, and how can they use them and we can't?
I'm going to let Deputy Moore, he looks after the fleet, so he could probably talk on that better than I can.
Through you, Mr. Mayor. Basically, we see private enterprises will purchase them and repurpose the trucks, or we would see non-Ontario-based departments that don't have to follow the same type of guidelines and legislation that we do are requiring them. But mainly repurposing seems to be the primary. Thanks.
And another question, Chief, is that have you seen an increase of the short-term rentals where you have to do inspections and so on? Does that show anywhere in any graph anywhere that your people have so many hours wrapped up with this, so on?
We didn't, through the mayor to the councillor, we didn't break it down in actual hours, but you can see that there'll be a slide in there in the last one, the STR applications. So our numbers were down, we did 457 in 24 and we're down to 406 in 25. They do keep track of their time. I just didn't break that down, but our numbers were down by 50.
Thanks for that. And also, you talk about training. I know training has to be all done by July 1st, 2026. Can people refuse to be trained?
Through the mayor to you, councillor, yes, there is nothing that, I'm looking to run a full-service department, so I'm hoping we'll get all our staff certified in firefighter 1 and 2 and hazmat, which is required. Yeah, there is some, and honestly, I can't blame them. Somebody that's 45, 50 years old, really, that never unfortunately got grandfathered into the service, just wants to protect his community, doesn't want to study and, go through all that, though he's certainly a qualified firefighter, but it does take time and you don't want to embarrass yourself by not studying and fail or whatever. So I am anticipating we will definitely lose some firefighters. By the time, I'm not going to put the deadline as of July 1st. We will continue to move with these people. Fortunately, we haven't been able to get all of our courses. We're still working. So it's pretty tough for me to ask you to leave if we haven't been able to offer you the training in itself. So.
Okay, thanks. And just the last one, a 32% increase of incident volume. I just want to congratulate you because for the emergency calls and fires and so on, that you still had the people to do it and still kept up with a 32% increase. Good job, and thanks for your thing today.
Good.
Deputy Mayor Richards.
Thank you, and through you, Mr. Mayor. Thanks very much for the presentation today, and, accolades does go out to your whole crew because, you really had to, you had quite a few different challenges this year, so, and the hours that folks were putting in and responding to the community are very visible. So just two quick questions. One was regarding the training certificate. I did bring a memo, and I was wondering if that was an indicator of some of the resignations that you've had in the last year.
I'm not going to, through the mayor to you, Deputy Mayor, I'm not going to contribute a lot of that at this time. It does seem like a large number. Unfortunately, we just do lose people. They change they move, change their life habit. It is a huge commitment. Some were collective agreement issues that had to be resolved, but I don't have an exact number on that, but some just say resign, some just don't show up, so I don't always have, but I'm not going to put a whole lot of that number towards that at this point. I think we're going to see that later this year.
Thank you, and thank you for the last part of that comment, saying that it is a concern clearly because of those hard deadlines. One quick question. You talked about who's responding app, and it needs some additional tweaks. What are those tweaks, and how do you feel that's going to roll out for 2026?
Through you, Mr. Mayor, the Deputy Mayor, Sean is our communications guy. I'm going to throw that to him.
Thank you, through you, Mr. Mayor. We're just looking at some additional training and getting everybody on it for the emergency management side. And then as far as for our response side, we're just trying to work with the ability to get more call data live onto the app in a more robust time frame. So we're working with the developer of the app and with our communications division within the city, because we do have some technical challenges around systems talking to each other. So if we can get that, then we'll get more data in a more reasonable time frame.
Thank you. Councillor Yo.
Thank you, and through you, Mr. Mayor, to the chief. Chief, thank you for the update. It's unfortunate that we keep having resignations, and for a service in the municipal act is very plain language that you need to have fire prevention services, and it's very bland. We seem to be turning this into a monopoly. I don't really call it a monopoly, but it seems harder to retain, and that's the main word, is to retain people with all the deadlines and demands and everything. So hopefully things will smooth out, and we can find people who want to help their community, who want to take the full commitment, or we can ease the commitment and get people who want to help their community. It goes both ways. I want to also thank you for the answer you gave to Councillor Warren, because I'm not sure if it was discussed during the term she wasn't in council, or she just forgot. But the reason we bought these big trucks, and the words came from your mouth as well as other chiefs we've had come across the podium, was these big vehicles and were the do-all and end-all, and they would spell the end of the small response vehicles, thereby saving us millions and millions of dollars. So I thank you for the answer that you're not looking at that at this point, because that would be very counterintuitive to the previous answers given. So thank you once again for your service and your report.
Thank you.
Thank you. Councillor Ashmore.
Thank you, Mr. Mayor. To you, through you to Chief Jones, thanks for the presentation, and thanks for your work and the fire service, and certainly a challenging year last year. Just two quick questions. On the screen, it mentioned about 50 or 51 resignations. Do you actively do exit interviews on firefighters and when they leave the organization to see what it was that caused them to leave? I know there's obviously people move and people have family reasons and other reasons, but are there exit interviews that are conducted all the time when people leave?
Through you, Mr. Mayor, the councillor, ideally, very seldom we do. There is a sheet that is given to them through people services that they can, put their comments on. Even on our sheet that they fill out that say they're resigning, if they do happen to fill that out, there is a spot for them to give a comment why, and if they ever want to meet with me or any of the deputies, they're more than welcome, but it's not something that's they take advantage of. It's there, but I very seldom get any back feed from that.
Okay, thanks. And finally, the last question is to do with tanker shuttle certification. Oh, it's great on the website that we have that, and every fire hall has that, and which is good for the public to see that. Just not too long ago, talking to my insurance person, that just looking at my policy, and I know I can't speak for everybody else, but I'll give you an example. Like I know I live 4.9. If you live within 5 kilometers of a fire hall, I live 4.9 kilometers as an example for the Dunsford Fire Hall, and that you do qualify for the shuttle tanker certification. But what the insurance representatives told me, and this is one of the Ontario Mutuals, is that they're looking at, and I'm not sure if you're aware of this, but they're looking at there could be possible increases in premiums if you're not close enough to a full-time hall. Is that something that you've heard? Because I was, hopefully that's not going to be the case, but because we know the service is there when we need it, and it's A1 service. We're not questioning the service, but I'm just wondering why insurance companies are getting skittish like that. Like they're even saying these things, that they're looking at that possibility of having higher premiums for people who are not within a certain range of a full-time hall. Have you had much, heard much on that?
Through you, Mr. Mayor, the councillor, I have not been made aware that they have been looking to make any differential between full-time and volunteers. My staff aware of any of that? No. And so, I mean, ideally the tanker shuttles should basically outweigh all that, but I know you do get credit if, probably more if you have a hydrant or a fire station, but,
Thank you.
Councillor Joyce.
Thank you, Mr. Mayor, through you. Excuse me. Yeah, Chief Jones, good presentation. The first thing I want to do is compliment you on the peer awards. A great move, and I'm sure it's being, well, I assume it's being well received. I think that's a great thing to do. My questions are, in the responses by incident type, is responding to automobile accidents, is that mixed in here? Or is that excluded, or where does that sit?
that would fall, oops, sorry, through the mayor to you, Councillor, that falls under the rescue.
Okay, thank you very much. That takes care of that question. I'm with Councillor Ashmore in the resignations retirement area. We need to work harder to understand the different aspects of resignations, because maybe we can do something to stem that. I mean, if they want to spend more time with family or they move away, we can't fix that. But there are other areas where we could possibly do an intervention to reduce that. But we need to understand if there's, first, why they're happening. So I would put it to you and staff to, if you can work a little harder to get that information and get some statistics going. Of course, the aggregate would be great. Last question. Oh, sorry, two more questions. The 30% increase in calls is, how's the morale with the troops?
Through you, the mayor to the councillor, most of them like to work. You know, sometimes if it's on a downslide, it's, you know, yeah, they just, you don't want people to pull away or whatever, but yeah, I'd say maybe this year it was a little, maybe too much work, but yeah, I mean, they enjoy what they do, that's what they're there for, and yep, the attendance continues, so per call, so.
Very good. Yeah, I was more concerned with our part-time firefighters being, again, time away from family. Full-time, that's their full-time job, so a little bit different there. Last question is, over the weekend, my sister-in-law who lives in Edmonton, there was a barbecue mishap, and she lives in not exact necessarily an old condominium. I'm not sure what the age is, but the building envelope caught on fire. It wasn't disastrous. It wasn't like a flash fire, but nonetheless, this vinyl did catch on fire. It got put out. Everything's fine. Everybody's okay. So my question is, have we done an inventory, and this would be partnership with planning, I think, any of our multiple story buildings, the building envelopes, we've seen what happened in Great Britain, we've seen what happened in India. Are there any buildings at potential risk are we even aware of? It kind of hit me over the weekend that what if we have a building like that somewhere in our region? We should be aware of it.
Through mayor to the councillor, I'm sure our director has, our building code is probably fairly stringent, and I'm not aware of any real concerns of, you know, exterior building, you know, I mean, we get the wood stuff that we've seen in Japan and yeah, and the ones in BC but I'm not aware that under the building code, if any of that is really allowed. It wouldn't fall under the fire service. It would be part of the building code, but I'm not sure if the director wants to speak in on that, but I'd probably put her on the spot, but I'm not aware of any major concerns, and that's why I said we do have, our fire prevention has track of all our multi-unit buildings, ideally within the city, that then they're are inspected, and, you know, on an average time, and not been made of any, ideally. One big concern we seem to have, unfortunately, is in the nursing homes and stuff where we won't allow you to put paper or some kind of any fabric ornaments on your doors. We certainly get a lot of feedback from that, unfortunately, but yeah, that's kind of out of the question, but it is something that is sure a lot of the public or people within these places aren't very happy about, so especially at Christmas time.
Yeah, very good. Actually, in her condo, they wanted to put out potted plants and whatnot at Christmas and festive areas in the hallway. But those had to be removed because in a smoke-filled corridor, there's a tripping hazard. So they weren't happy with that either. So thank you very much, Chief Jones.
Thank you. Councillor Perry.
Thanks very much, Mayor, and I am aware of the hour. So just very briefly, I know that you had to follow up on Councillor McDonald's point. I was curious about the STR figures. I know in slide 1, 2, or 3, you had nature of calls, service calls, responses for STRs. And I know you hadn't desegregated the data in terms of staffing hours. Could you speak briefly to kind of what the nature of those responses are for STR-related calls?
Through the mayor to you, Councillor, not so much as calls related to go out. It's just when somebody puts in the application, our staff is responsible to review to make sure that the plans and they meet all the safety precautions. Most of the time involving STR, it's not so much the fire prevention, it is on the fire side where they have an outdoor fire which isn't within the proper zones or locations.
Okay, thanks. So the slide that we were seeing there is total calls in terms of, as you say, includes administrative calls.
Yes.
Yes, I'm interested to see at some point how many calls are STR related and what those would be. Are they related to breach of a permit? Are they related to too much of a fire? Those kinds of things.
Yeah, wouldn't include the fire calls.
Okay.
That would be under the fire response.
Okay.
We do have those broke down. I didn't break them down specifically, but
perhaps there is a way to desegregate that because
we do keep track right on it. If it's an STR, they're supposed to let us know because it's under the regulations of an STR, you can only be called out so many times or so many complaints to that property. So we work with bylaw, transforming that information back and forth.
And just being only a couple of years into the program, it'd be nice to see kind of what resources are being tapped and why, and whether it's an increase or a decrease. And second, on one of the slides there, you had public hazard responses.
Yes.
And it seems to have just skyrocketed relative to last year. Was that ice storm or?
So that's CO calls with no CO, trees down, hydro lines down. Okay. So the main of that number would be contributed to the ice storm.
It does include ice storm response. Thanks very much, and thank you for all you do and for the great presentation this morning.
Thank you.
So, seeing no more questions, thank you for coming today, Chief, and thank you for the report. We'll move on to that report now. First of all, we have a mover and seconder, so all in favor of the presentation, and that's passed. And we have the report to be received and brought forward to council for consideration. I have a mover and seconder, Councillor Yeo, Councillor Ashmore. Any questions or comments on the report? Seeing none, all in favor? And that's received. Thank you very much, Chief. It's 11:58. Lunch has been delivered. So we'll come back for 1 o'clock. And see you then.